Good morning.
Good to go.
Yes, TG, start, please.
Namaskar, good morning, friend, and a very warm welcome to you all on our virtual speaker series on Ayurveda. And today is our 19th session in a series of pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicine. And the topic of today is the effects of Avipattikar Churna. And we have very special speaker, Dr. Rahul Gujarati, who would be giving us the presentation, and somehow Vaidya Meenakshi Gupta could not join, but we'll be having another speaker giving his presentation. A very warm welcome, Rahulji. And friends, we have two very special guests with us this morning, Dr. Arun Chokalingam, who's the Professor of Medicine, Global Health, University of Toronto, and also the Chair of World Congress on NCD 2023, Non-Communicable Disease, and former founding Director of Global Health, NIH USA. Welcome, Arunji.
Namaste.
And also, friends, we have Dr. Harvey Skinner, Professor of Behavioral Psychology and Health Science, Clinical Psychologist, and the founding Dean, Faculty of Health, York University, Toronto. Welcome, Harvey. Thank you for joining. And friends, we'll divulge briefly on World Congress, which Dr. Chokalingam is chairing. Both are a strong friends and advocate of our initiative as well, and we really thank them. We'll hear more about this Congress from Dr. Chokalingam and Dr. Harvey. And in that Congress, which is happening from June 25th to 30th, we are also organizing a session, a plenary session on Ayurveda, its impact on mental health, and encourage everyone to spread the awareness about this Congress. And it's going to be attracting a lot of international speakers all across all walks of life, and a very power-packed Congress, which is going to take place from June 25th to 30th. And I would invite Dr. Arun Chokalingam to say a few words, to give some briefing about this Congress, and we'll keep you posted about our session, which will be organizing. Over to you, Dr. Arun Chokalingam.
Thank you, Satish Bhai. It's an honor and privilege to join all of you. And a special thanks to see my longtime friend Madan after so many years. Madan, so lovely to see you. Vermaji, would I be able to share my screen?
Yes, yes.
Okay, let me just go into my screen. Are you able to see? Not yet.
Not yet.
Okay, share screen. Yeah, Congress website. Can you see now?
Yes.
Yes, sir. Yes, sir.
All right. The World Non-Communicable Disease Congress will be held in the Metro Toronto Convention Center, the largest in the country, and with all the facilities. And the dates are, as Satish Bhai mentioned, it's 25 to 30 of June. And please do visit our website, which is called TorontoWNC2023.org. As you can see, we have got some eminent speakers. Speakers list is here. And many of you might know people like Dr. Srinath Reddy, Dr. Salim Yusuf, Dr. Soumya Swaminathan, these are all from India or Indian origins. And then from UK, Professor Michael Marmot and Sir Andy Haynes. So they will be here as well. And those people working in the area of cancer will definitely know Professor Felicia Marinol from Miami. And the people from I will definitely know Dr. Sir George Allain. He was a former head of PAHO, and he became the chancellor of Caribbean universities. And we will be joined by the World Health Organization, Dr. Bente Mikkelsen. She is the director of NCD. And we will also be joined by World Bank, the former director, Dr. Timothy Evans, and as well as Dr. David Wilson from Washington. So as you can see, there is quite a number of people from different walks of life will be joining. That is because this Congress is not dealing just separately on cancer or cardiovascular or diabetes, but it's looking across. And our objective or the key theme of the Congress is equitable and sustainable health for all. In today's world, when the cost of medicine is so high, not nearly 70% of population are not able to attract or reach out to the information or the therapy that they need to. I think this is where Ayurveda, what you are doing is changing lifestyle through food habits, through the activities, and at least Madan will understand if I say something in Tamil. Tirukkural in Tiruvalluvar says, Noi nadi, Noi mudal nadi, adu tanikkum vai nadi, vaipachayal. The role of the physician is not just to treat the condition that you see right in front. You have got to find the root cause and find out what will avoid that. I think that's what Ayurveda does. So you have got a greater contribution to make. Some of our Congress themes are, it is working on, say, 6 themes: reducing inequalities, impact of climate change and environmental degradation, human migration. Thirdly, change of across the human lifespan. So many of these things we can prevent early on, rather than spending all our money, energy, and resources at the very end of the last 10 years of human life. Identifying and implementing multi-morbidity, multidisciplinary, and cross-geographic solution. Once, what was a problem in the East was not a problem in the West. But now we are living in a globalized world. People are moving back and forth. So the problems of India is a problem of United States. The problem of Africa is a problem of UK. So as people migrate, so we need to understand. Now, what are the new research saying? What are the perspectives? What are the theories? What are the policies that can modify or control the chronic disease, including the technologies, use of artificial intelligence, machine language, big data, and telemedicine. And finally, improving governance, health system organizations, multilateral collaboration, and knowledge exchange. So this is a multifaceted Congress, not just an ordinary cardiology conference or a cancer conference, but it looks across the various diseases. So now we have got 6 thematic plenaries, where all the eminent speakers whom you have seen will be speaking. Then followed by the plenaries, we will have a number of breakouts. I think in one of them, we will have the Ayurveda session as well. So there is a lot more to contribute. Everyone can benefit. So the ultimate goal is to bring equitable and sustainable health for all. We want to minimize the out-of-pocket expense for many people who save for the entire life and then lose everything in the last 2 years or 3 years of their life, and then leave the entire family in debt. So I think that is the goal with which we are working on. But it's coming along. We have got over about, say, 350 abstract presentations. And we would love to see as many of you as possible at the Congress. And your contribution is extremely valuable. I welcome all of you. Thank you.
Thank you, Dr. Chokalingam, and it's a very our admiration and respect for all the work you've been doing over last many decades. And congratulations to you and your team for putting together this wonderful, very timely Congress. And friends, CIF is a partner organization in this initiative and effort, and we'll be working very closely with Dr. Arun Chokalingam and his team, that how Ayurveda, the holistic health, which we've been promoting and trying to create that environment, how we can help in this Congress. And we also have Dr. Harvey Skinner, who is a great champion and advocate of holistic health. And we would like to hear some of his thoughts. We recently had a conversation with him, a meeting that how we can put together an event at this Congress. So would like to hear some of his thoughts as well. Dr. Harvey, welcome. Over to you.
Thank you very much. And it's really a privilege to be invited to join this our series here this morning. I would first underscore what Arun said. We're facing a crisis in health care around the world, and increasingly we can't afford it, and millions of people cannot get access to it, even in very rich countries. And in our country, in Canada, in poor communities, try to get access to a psychiatrist outside of a major city. So there's issues here, even in Canada, with our publicly funded healthcare system. And a lot of this is because of chronic conditions. That's why people are going to hospitals and clinics. And many of these, like type 2 diabetes, could be largely prevented through proper nutrition, exercise, reducing stress. So the Congress that Arun is doing a brilliant job of organizing, and a lot of the main themes of the work is really focusing upstream, keeping people healthy. And that's really the goal, keeping more people healthy longer. But then when you need medical care, you want to make sure you get access to that. I've been looking at Eastern approaches to wellness and to health, and particularly looking at traditional Chinese medicine, looking at Ayurvedic medicine, looking at Buddhist teachings, and, for example, mindfulness meditation. And there's a lot of growing research, Western science, supporting these approaches. So if I look at, traditional Indian medicine, I see three challenges. The first is education. How do we get the general public more informed about Ayurvedic medicine and the various facets of that, and how helpful it can be? Yoga is becoming particularly popular now and well known in North America, but the other aspects of traditional Indian medicine are certainly much less known in the general public. So one is education to the general public, and equally, and maybe even more important, is health professionals, doctors, nurses, physio rehabilitation professionals. most of them in their current curriculum get very little exposure, like even to Western approach to nutrition, let alone the science around Ayurvedic nutrition. And there's lots of reasons behind that, but they're really slow. We're training specialists who are just a very limited understanding of the holistic nature of what health is and who we are. So we need a major new approaches to getting this into the curriculum, really at the undergraduate level, and basically opening the the blinkers to our young health and social service professionals to these range of more holistic and preventive approaches. And I would say strategically, Ayurvedic, lead with yoga. Yoga is well known and increasingly a good science behind that, and got to capture people's attention, and then also look to the 4 or 5 other major aspects of traditional Indian medicine. So that's one, it's education. The second is research. In fact, there's a lot of good research now, even Western science, particularly if we look at yoga, supporting its positive effects on reducing depression, and studies in schools showing how it's helpful for dealing with stress levels of students and making them more productive. But we always need more research, and the challenge here is what I would call is getting the knowledge out there, knowledge mobilization, because I can do a systematic review, I can get the journal articles, but I'm a university professor and I know how to do that. The broader public don't have that sort of access. So getting it out in policy briefs and really short little YouTube type videos, so that the general public and also the health professionals understand that, because most of them think of this as kind of voodoo crazy stuff, but in fact there's really good Western science as well as Eastern science supporting the value, and also showing what are the concerns. I mean, we need to be careful on guidelines on how we use the approaches. So it's research, but getting that knowledge mobilized is a second key point. And the third one is access. Right now, I know when I was teaching students and they're really interested in this, but how can they get access to it? First of all, being aware of the various sort of clinics that are offering Ayurvedic medicine, but secondly, it's currently not part of, well, yoga may be covered by some private insurance plans, but most of it's not covered through insurance plans. So, and this is really a public policy. How can we get our healthcare funding to more broadly to fund these holistic approaches? And that's sound investment. We're investing money in prevention. We're investing in adding years to people's life and life to their years. And then when they do need later on access to healthcare, then it will be there, it'll be effective. So how do we, by increasing access, it is a sound investment. So those are the 3 points: education, research, and access. And so I'm really pleased to be able to listen in to the rest of today's program. And I want to thank you. It's an honor for me to be here with you. Namaste.
Namaste. Thank you so very much, Dr. Harvey. Very, very insightful comments. And all these 3 points, actually, we are working very closely on that. And one of the key objectives of starting this series is to create that awareness and outreach effort, which we are trying to organized through that. But you're absolutely right that we need to reach out to the healthcare professionals community more and disseminating the knowledge in a very simpler form. And we have various experts today who will be presenting on this particular topic, which is the today's discussion. And we are seeking your guidance and your mentorship as well, that how we can advance this as we all working on the prevention aspect of it. As Ayurveda, you all know, it's a meaning of it is a science of life. or knowledge of life, right? So with that note, I would now request Dr. Harish Verma to please start the session, and Dr. Madan Thangavelu and Dr. Bhaswati ji, who will moderate the session, and maybe starting from some comments or feedback on the comments Dr. Chokalingam and Dr. Harvey have given. So we can maybe start with that. Dr. Verma, over to you.
Thank you, Steve ji. And Namaskar, good morning from Toronto. Friends, welcome to 19th session of virtual lecture series on pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicines. Friends, we are running this virtual lecture series from Canada with the support of Canada-India Foundation, Toronto, Consulate General of India, Toronto, American Association of Ayurvedic Professionals, US, and Ayurveda Union of Midwest, US, Association of Ayurveda Academy, UK, European Ayurveda Association, Germany, International Ayurveda League, Mumbai, India, Tathastu Magazine, US, and our media partners in Europe, UK, Canada, and US. Today, the topic is pharmacological and therapeutic effects of Avipattikar Churna. Avipattikar Churna is a poly-herbal traditional Ayurvedic medicine which is used in a wide range of gastrointestinal disorders to remove excess pitta or heat from the gastrointestinal tract. Avipattikar Churna is highly advisable for symptomatic relief of gastro-esophageal reflux disease, which is also known as GERD. Avipattikar Churna can treat nephritis by reducing inflammation in the kidneys, glomeruli, tubules, and interstitial tissues. So we will learn from our experts. Today, we have Dr. Rahul Haridas Gujarati ji with us. He is working as a professor and head of department at Bharatiya Vidyapit College of Ayurveda in Pune. He has published many research articles in index journals and given many presentations in national and international seminars. Currently, he is also on board of studies at Bharatiya Vidyapit University and Banaras Hindu University in Varanasi. Welcome, sir. Our expert will enlighten us about pharmacological and therapeutic effect of Avipattikar Churna, and he will also share his experience about Avipattikar Churna. And Dr. Meenakshi Gupta couldn't join due to some health issues. Sorry for this. And we are also thankful to Dr. Arun Chokalingam ji and Dr. Harvey Skinner for joining today's webinar. And we have today with us Dr. Madan Thangavelu ji from UK. He's a genome scientist. He will moderate this session. So without wasting any time further, I would like to invite Dr. Madan Thangavelu ji to moderate the session. Over to Dr. Madan ji. Thank you.
Harish ji namaskar, Satish ji namaskar, and pranams to Arun and to Senior Professor Dr. Harvey. Greetings from Cambridge. It's always a challenge to come onto these programs and provide a brief but a punchy introduction. Now, we are very fortunate that we have here Arun, who introduced the big congress that's coming up in Toronto. And Harvey, you have correctly connected us to health issues and the challenges in education. Here in the same challenge here in Europe too, where people still feel this is all hocus pocus and voodoo stuff. And how do you change that mindset? And hopefully these kind of discussions will take us forward. Mankind has always had food, and food, along with inputs that come in through our five senses, is what holds us together. And both of those issues also lead to complications, health complications. And Harvey, you're providing us that input and that link between these two. in terms of the mind and the body. And as Arun correctly said, complications related to both of those give rise to diseases where the cure might have to be found elsewhere. In discussing this event, Harish ji and I, we were considering how the traditional systems of medicine have, over the thousands of years, looked, explored at herbals and found solutions, and how today we are seeing mechanisms that can be understood by looking at these ancient formulations. And when we talk particularly about the gastrointestinal conditions, we see not only effective remedies, but also a collection of powerful clues that can be used to understand the neuroanatomo-physiological aspects of that whole big entry point of food into the body. We are very fortunate to have with us expert speakers. We listen to them, we learn from them, and come back to comment on what we learn. Thank you, Harish ji. We move on. Perhaps we'll start with our first speaker joining us from Pune. Namaskar ji. Rahul ji, namaskar. Thank you for joining us from Pune.
Namaskar. Thank you for inviting me. May I start?
Please.
Yes, sir.
I cordially thank the Tathastu magazine, the Canada India Foundation, for giving me an opportunity to share what I have understood on Avipattikar Churna. One. Secondly, I'm also thankful to Harish ji. He was in contact with me a few days, I would say a few months ago also, but due to some reason or other, I couldn't consent to come up over here on this platform to speak on this topic. Again, he called me back a few days back, insisted, and I tried. Yes, I would go ahead with it, and I have prepared my presentation today. He has asked me to speak specifically on pharmaceutics of Avipattikar Churna. I am thankful to all the esteemed panelists over here. Can I share my screen?
Rahul ji, you should be able to do this.
Yeah. Okay. Is the screen visible now? I
It's
hope
just
so.
coming up. Yes.
Yeah.
There.
So, Avipattikar Churna, as rightly said, we have
Rahul ji, your screen is, there's some delay in your screen loading up. Did you want to
I
try?
hope it's.
Oh, there it is. Thank you.
Is that there?
Yes, if you could put it to.
Yeah, I will take it on the full screen mode.
Thank you.
Just a moment. Yeah.
Thank you.
I hope it's visible now.
Okay. Thank you very much.
Yeah. So, as rightly said, Avipattikar Churna is a poly-herbal compound. We in Ayurveda use poly-herbal and herbo-mineral compounds. There's a lot of talk around India that mineral compounds from Ayurveda are not or are banned in the by the European Union and in the Northern America to be used as medicines. Even a few days until a few months ago, we were always told that we cannot practice Ayurveda over there. It has to be sent as a food supplement, and what's all those shits over there. Some of my friends are staying in the US. They told us that no, it's not so. Yes, you can practice herbal medicine over there, not the herbo mineral parts. As we have already seen that Avipattikar Churna is a medicine which is being used for the disorders of the gastrointestinal tract predominantly. Yes, why do we say so? Or why is it important for us to treat the gastrointestinal tract? Because it is considered that all diseases, they originate due to the loss of homeostasis of the gastrointestinal tract. It might be a problem with digestion, it might be some problem with evacuation, anything, but the origin of all diseases, they start from the gastrointestinal tract, and therefore a person with a healthy gastrointestinal tract would hardly have any disease. He would be leading a healthy life. This is what has been told by Ayurveda, and it is practically seen also. Throughout my presentation, or at the end of my presentation, I might bring up 1 or 2 cases which I have treated successfully with Avipattikar Churna. I am having a background of pediatric medicine. I am teaching pediatrics at Bharati Vidyapith. So my patients are mostly pediatric patients, and therefore I use that medicine in pediatric patients for a various kind of diseases, a various range of diseases. My presentation has some part of pharmaceutics and also some part of recent researches which have been done over Avipattikar Churna, and are available online also. So going back to the thing, when we say that it is used for gastrointestinal diseases, let me make it clear that Ayurvedic, in the initial Ayurvedic classics like the Charak Samhita, Sushruta Samhita, there is nothing known as Avipattikar Churna. The mention of this specific compound comes up in the later Samhitas like the Bhav Prakash Samhita or the Bhaishajya Ratnavali, where it has been used for treatment of Amla Pitta, where we can correlate Amla Pitta as acid peptic disorders, rather than just considering it as hyperacidity. We would talk more of acid peptic disorders where this can be utilized. Now, practically, what Charak Samhita says is that the normal rasa of pitta is katu in nature. It is somewhat what we can call it as pungent. It is never amla. If it is not formed properly, then it is going to be amla in rasa, and therefore this unformed pitta is going to create, or unformed or abnormally formed pitta is going to generate multiple gastrointestinal diseases, because pitta is responsible for digestion of food what we intake, and if it is abnormal, if the digestion fire is abnormal, then it is going to abnormally digest the food. So Amla Pitta itself is an abnormal form of Pitta. It is not the normal Pitta. And so to treat this, we are going to use Avipattikar Churna. It is also used for management of constipation, management of urinary disorders. In the Falashruti, I hope everyone is from the Ayurveda background or knows much of Ayurveda. So there has been something known as prameha. We equate prameha as diabetes mellitus, but it's not exactly. So if we go into details, we can include the urinary tract disorders where there is polyuria or abnormal urine formation, then we can include them under prameha. So
Rahulji, sorry to interrupt you. I don't know if your slides are meant to be moving. We are on the introduction slide. If it's, could you?
Yeah, we are on the introduction slide.
Keep in mind, we will stop you at some point because we'll be running out of time. So
no problem, no problem. It is also in pediatric practice where I have used, it is also proven to be useful in controlling and treating allergies. Now, what are the contents of Avipattikar Churna? Half of the content is castor sugar. 1/4 is nishot, what is known as trivrut, Operculina terpethum. 1/8 is clove, lavanga. and the rest, they are other medicines, about 10 other medicines, which are 10 to 11 other medicines, which are equally used in equal quantity for preparing this medicine. How it is prepared is we prepare a superfine powder and then we mix all of these contents together. So if we look at the composition, half of it is castor sugar, 1/4. The second most important part ingredient is operculina, what we call it as trivrut, and 1/8 part is clove. This slide shows us all the properties of the ingredients which are taken up into the Avipattikar Churna. If we go into detail of each and everything, each and every drug, it will take a lot of time. But in short, all the drugs which are used, they are singularly, when they considered, they are mostly of katu rasa, that is, they are somewhat spicy, they are somewhat pungent in taste, and they are laghu, they are easy to digest, and they are tikshna. So if we look into the action of this rasa and guna and virya, we can say that these all are of digestive property. They improve your digestion, they will eliminate the ama in your body, and they are going to generate anything that is normal for you. They are going to eliminate am, which is the main constituent of all disease processes. Now, these are some slides where we need to go for standardization. I thank all my friends who have helped me in preparing this presentation. They are from the pharmacology background. So they told me how they go in for testing this. I won't go into details, but when we go for standardization of Avipattikar Churna, it has been found that it contains alkaloids, tannins, it contains steroids, tannins, phenolic compounds, and saponins. Rarely there are some alkaloids in some mixtures of some pharmacy products. It also contains quite a good amount of electrolytes because of the presence of lavana. It contains carbohydrates, which is mainly because of the castor sugar which we are using. It contains some amount of proteins. It contains fats and fixed oils. So when we talk about pharmaceutics, we need to standardize the drug, and in a standardization, we need to see that there are presence of tannins, saponins, and carbohydrates. According to Ayurvedic classics, the therapeutic uses of Avipattikar Churna is Agnimandya, that is inadequate or improper digestion of the food what we take in. That might be gross digestion, that might be micro digestion. Then second one is constipation, malabandha. Third one is amla pitta, that is dyspepsia. Fourth one is arsha or hemorrhoids, which is a complication again of constipation. Then mutrabandha, or we would consider it into prameha, that is the urinary disorders, and again, which is not there in therapeutic action, we have what we use it. I have used it in allergic disorders in children. Those might be respiratory allergic or skin allergies. So how does the drug act? As I have already told, that there is about 50% content is castor sugar, which is snigdha and sweet in nature. And it is, according to Ayurveda, castor sugar, that is sharkara, is the best medicine which can suppress pitta. So therefore, the amla pitta which comes up, which is going to cause heartburns, which is going to cause blenching and all those things, it is going to suppress that abnormal pitta. So symptoms of hyperacidity, symptoms of belching, all those will be controlled. It is going to reduce the symptoms of daha, that is the burning sensation. It might be heartburns, it might be throat burns. It is going to reduce that. Also, it reduces, the sugar reduces nausea and excessive salivation. So the activity of Avipattikar Churna would be of mainly because of the sugar content of it. The second one is Trivrut. And Trivrut in Ayurveda is considered to be a mild to moderate laxative. The bark contains the alkaloids of the bark of Trivrut. They are considered to initiate peristalsis, and therefore, when there is excessive, when we ingest Trivrut, the peristalsis set in, and therefore excessive of pitta, which is accumulated in the GI tract, will propel forward and will be excreted out through the mild process of virechana, mild virechana. The third one is lavanga, that is the 1/8 part, and it is katu tikta, laghu tikshna, and shita. Lavanga is digestive, it cures dyspepsia, and it is also going to reduce the abdominal pain. Acid peptic diseases, we know gastric ulcers or peptic ulcers, duodenal ulcers, they are all going to cause severe pain in the abdomen. That might be related, that might be pre-food intake, might be post-food intake. But because of that pain, the life becomes very difficult. The pain is severe in nature, and lavanga has got an activity of shula prashamana. It suppresses pain. Now this pain comes up because of the irritation of the gastric mucosa, which then leads to formation of peptic ulcers or duodenal ulcers. So excess of acid is going to erode this mucosa and cause ulcers. So Trivrut is going to remove excess of acid by the process of purgation or laxation, and lavanga is going to reduce the activity of the pain which is generated because of the ulcers. The rest of the drugs, they are in minimal quantity and they all are having digestive properties. One part of is Triphala. Triphala also is a mild laxative, but it is also digestive. It helps in digestion. Trikatu, it helps in digestion. Vidanga, it's help in digestion. So they are all going to help or aid digestion. They are going to aid in digestion of ama and eliminate ama, and therefore in absence of ama, the doshas which come up, they will be normal, and therefore they will be reducing the symptoms of the diseases. What activities do these ingredients have? It has been proven that haritaki, maricha, and pippali, these are cytoprotective on the gastric mucosa. They protect the gastric mucosa. They help in secretion of the mucin by the gastric cells, and therefore they are going to protect the gastric mucosa, preventing generation of peptic ulcers or the duodenal ulcers. Shunthi decreases gastric secretions, increases the mucosal resistance, and potentiate defensive factors of the gastric mucosa. And therefore, the activity of mucin secreting cells improves, creating a physical barrier between the acid which is secreted and the cells which are exposed to the acid. One. Secondly, the amount of HCl which is secreted by the peptic cells will be reduced significantly by Shunthi, and this has been proven. Researchers have shown that use of of Avipattikar Churna reduces the volume of gastric contents. It might be by reducing the secretions of the gastric juices. It might be by further propagation or propulsion of the gastric contents into the intestine faster. It reduces increased gastric pH, which is an activity of Shunthi, Amalaki, and castor sugar. Because the gastric pH is reduced, because the mucin activity is improved, the gastric irritability index is reduced. The ulcer score is reduced because the ulcer start healing or the ulcer decrease in size. The length of the ulcer reduces, and therefore the ulcer score of the GI tract reduces. The effect of Churna have been proven to be equivalent to that of ranitidine, a H2 blocker, which is the cells H2, the histamine, which is responsible for secretion of acid. So ranitidine is used as an H2 blocker to reduce gastric secretion of acid. Now, it is a known fact that H2 blockers also, which are responsible for histamine, the histamine is responsible for allergies. So the effect of Avipattikar Churna can also be used or also been seen on diseases which originate out of allergies. So Avipattikar Churna should not be limited only for its use in GI tract disorders, but also for the allergic disorders. And it is non-toxic. It is completely of herbal origin. So, and animal experimentations have shown that the amount that the drug, even if used for a longer time, is non-toxic. This is a research from the clinical diagnosis journal of the clinical diagnosis and research, where they have shown the use of Churna. They have compared the use of Churna and ranitidine, the Avipattikar Churna and ranitidine, and they have shown that there is a comparable similar activity of Churna and ranitidine on various parameters. Animal researchers have shown that it has got a significant antioxidant activity, and this antioxidant activity is also seen in human subjects, and therefore it can reduce GERD and hyperacidity. It contains bidlavan, a salt, and therefore it is the bidlavan also helps in regulating potassium and sodium and chloride pumps. Also, it helps in transport of alanine, proline, tryptophan, and tyrosine. Bidlavan is carminative. Lavana itself, they are carminative. All kinds of lavana, they are carminative, and they are also initiators or triggers. Lavan triggers gastric impulse, and which helps in increasing the peristaltic movements. So these medicines, when used together, they are going to help reduce GERD, faster movement of gastric contains faster movement of acid, and therefore they are going to help in healing the gastric or the peptic or the duodenal ulcers. This analysis has also shown that Avipattikar Churna contains zinc, and we all know that zinc is an important ingredient for maintaining the integrity of the GI epithelium. As I have already spoken, Maricha is helping the secretion of mucin by the gastric cells, which prevents as a physical barrier, but also Maricha has got an antioxidant activity because of alpha tocopherol. Then the bark of Trivruth, it possesses enhanced ulcer preventive and protective activity when compared to ranitidine. There also the bark of Trivruth enhances gastrointestinal motility, which is a cause of mild purgation. It shows an laxative activity, and therefore it causes early clearance of the gastric acid. Operculina terpethum, that is Nishoth, has also been known to induce apoptosis of malignant cells in animal models. We all know Emblica officinale, that is amla, has an inhibitorist activity over the gastrointestinal pathogens, including H. pylori, bacteria which is considered to be the main causative organism for acid peptic diseases, and also for peptic ulcers and duodenal ulcers. So amla helps in eliminating or suppressing H. pylori. The other contents, they all have either laxative, antioxidant, or analgesic activity. whereas piper longum and gingiber, that is shunthi and pippali, they augment mucin secretion and they decrease the cell shedding of the GI tract. Now, as I have told you that I have used this medicine not only in hyperacidity in children, not only in the abdominal pain in children, and not only to clear constipation, I have also used in 3 kinds of different allergic disorders like urticaria, like respiratory allergies leading to severe cough, or recurrent respiratory disorders which have cough as a major symptom. And the third one is allergic rhinitis, where I have got a very good effect on pediatric patients. I hope I have covered the points of pharmaceutics. Thank you.
Thank you, Rahulji. Thank you very much for pointing us to some very specific details. You touched briefly on combinations, and particularly the Trivirt, which is a very powerful, potentially a single plant that can provide a lot of relief, particularly in that area as a prokinetic agent for improving GI tract motility. And this seems to be the general trend with many of these herbal formulations. We find similar formulations in Chinese medicine. We find a collection of formulations in Japanese, the Kampo medicine.
Sorry,
And they all
sorry.
seem to
Dr.
come-
Rahul, can you stop sharing your screen, please? Sorry, Dr. Madan.
No. Thank you, Rahul.
Just a moment. Dhruva केम करवानो रे share screen बंद.
Could maybe somebody could control it, stop share
Can
from,
you? I can't. Can you please help me out?
it should be on the top of your, on the top
Yeah,
bar.
there's a new share.
Bear with me, sir. We see, you should be able to just turn the screen off on.
Okay. Stop
Dash.
sharing. I'm not getting that tab of stop sharing. Yeah, I have got the pause share. Okay, fine.
Thank you.
So the screen sharing has stopped probably, right?
Not yet.
Not yet.
Bash, could you? Oh,
Okay, okay. Thank you. Thank you, Dr.
Yeah.
Rahul.
Yeah,
Thank-
thank you. Thank you.
thank you, Jeet. Many aspects of GI tract health are controlled by GI aspects of GI tract physiology, particularly motility. And these poly-herbals seem to have an effect on this. And I said earlier, we see poly-herbals of this nature in all the systems of medicine, Chinese, in the Kampo medicine, and perhaps in the South Indian system of Siddha medicine too, we find. And still to be understood, the best examples that we have as yet are examples of Kampo formulations, where they have discovered many aspects of how these formulations work. We are very fortunate to have here with us Professor Tanmay Goswami, joining us from Madurai, from Madura in Uttar Pradesh. Tanmayji, namaskar. Tanmayji, namaskar. Thank you so much. Tanmayji not only leads a very large university.
Hello, am I audible?
We can hear you clearly, sir. Thank you so much for joining us at such short notice, because Nakshi could not be with us today. Welcome you to the platform. And just for everybody's sake, Tanmayji leads the big university in Madurai, in Mathura, and
Right.
is also an Ayurveda physician. Tanmayji, you're going to tell us a little bit about your personal experiences on how you have used this age-old formulation and the beneficial effects you've had. Perhaps something else too you want to share with us. Thank you. Welcome to the platform, sir.
Right, right. So as I understand that our at present audience is not just limited to all the sharing people, those who are here in front of me, because through social media we can reach to n number of people, and those who know the Ayurvedic language and those who don't know Ayurvedic language, I think both are going to enjoy and get benefited by this forum. So it's not very easy to share uh, experience in Ayurvedic language only, or to explain the results of Ayurvedic clinicals in the language of Western medicine. It's very much like we are a little bit advanced in that way. I would say, for example, now we believe that there are bitter receptor in liver, okay? And all medicines of the liver, Katuki or Chiraita, all are bitter in taste. So the point is this: before going with Avipatti medicine, if I give one very nice analogy, if a teenager want to understand, and the elders want to say something, and there's a different languages, the teenager is not able to understand elders' language, what the person want to say, but doesn't mean that the elder one who is telling something is wrong. But with the time, I was hearing Dr. Harvey Skinner. He was telling very good point that now Western medicine is accepting it. They're supportive. So as there is more and more researches are coming up, there is a big acceptance coming up too. Well, so it's very difficult for me to explain this plant medicine pharmacokinetics and dynamics, how it works, but I'm going to share very interesting results. There is no Ayurvedic doctor in India, I would say no, I'm using this word, who is not using this Ayurvedic formulation of plant medicine in his or her practices. Each and every person. At least as an antacid they are using, at least as a laxative they are using, but people are using. The reason is this, that it's palatable. It has, because of its sweet taste, some of the Ayurvedic few medicines which are palatable, so it's very much accepted and very quick in result it is. Now, once when I used it in my medical practice, I prefer to, if you see, there's a different type of references, but I prefer to use, can you see this book I'm keeping in front of you? This is a Sahasra Yoga, and this book gives a formula called Avipatti Churna, not Avipattikara. The term uses Avipatti. And whole my practice, I was very much surprised. Why are they using this word Avipattikara? Vipattikara and then Avipattikara. Why not use Avipatti, which remove Vipatti? Vipatti means, for those who don't know this Indian language barrier, those who have, Vipatti means a trouble, a catastrophe, actually, a problem. Avipatti means the one which removes catastrophe or a difficulty from the life, here in the sense of health. So I would use word Avipatti Churna, not Avipattikara Churna, because I like that better. Formula is very much similar. 3 Vyosha means those. I won't go in detail of that. But if you see, the formula is amazing, so simple. 3 Katu, 3 Phala, 3 Jata means Ela, Lavanga, and Patra. And Vidanga is a very powerful medicine here. And Musta, Cyprus rotundus, which we should remember. This combination is a broad spectrum GI medicine, you can say. Even for diseases which have loose motions, like Crohn's disease, there also, if you combine Avipattikar with Godanti, a particular mineral, which is calcium based, it works fantastic. In any of the case where you don't want purgative action, what you should do, you have to add 10% of Godanti powder to this Avipatti powder. And then if you give this, it works after food, in a little amount. It works fantastic for liver and for any type of ulcers, especially in peptic and gastric ulcers, especially peptic ulcers. It is a wonder wonder drug combination. Now, the moment you use this in a bigger quantity, it becomes purgative. When you use it in a small quantity, it's one of the great anti-inflammatory for GI tract. All pitta problems are actually inflammatory pathologies, if you want to make it in a gross level, if I want to say. So the moment you use in a smaller quantity, it's a wonderful anti-inflammatory, anti-acidic, and it neutralizes, as I said, anti-acidic means neutralize acids and remove any type of secretion-based, like even chronic pancreatic diseases, pancreatitis, even in those conditions, it is fantastic in results. Moreover, what I have seen in surprising results is when it is given in CKD, chronic kidney diseases, where kidney is not able to remove creatinine, and when you want to remove it through intestinal route, of course, Trifla also works, but this works as a surprising results. In 1 month, if serum creatinine level is above 7 or 8, it starts gradually tapering down. In beginning, it won't show any results for 15 to 20 days, but if you continue keeping faith of your patient of CKD in Avipatti combination consistently, it gives wonderful results from 6 to 5 to 4 until 3. But then it won't go down. But patient lives very good life. He is not on dialysis. He won't need to go. Health is perfect, and maintain that because intestinal route is used to remove creatinine actually. 1. So it's the same medicine. Once when they have talked about Avipatti Riyam Namna Prashasta Pitta Roginam in all type of Pitta diseases. Once when it's a Pitta Roginam, now I am going to use it for a number of Pitta problems, not only related to GI only, even to skin-related Pitta problem. Even in Vata Rakta, I have seen fantastic results along with Guduchi. So this is actually a wonderful base medicine where you can work on blood, even in like inflammation, blood-related problems, even all type of immune reactions, including autoimmune. There also, it has given a fantastic, satisfactory results. So I'm going to as I discussed, Dr. Harish, you told me that's a 5-minute time. I think I'm touching it. So I can conclude that this is such combination that even a doctor who has no knowledge of Ayurveda he will get results. This is something which is surprising. But if you know how to use it, like if you have a good idea about quality influence, how like lavanga. Lavanga is actually spice, but its results are very cooling. It's example given in Charaka Samhita, 27th chapter, that it has a cooling results on even surprise, lichen planus, autoimmune of oral mucosa. This, if it has been capped and just in cavity, it's shown results. Even in throat inflammations, means anywhere there is inflammation, you can use it for gargling, you can use it for oral rotation like kavala and then spit it out. You can take it also along with yashti madhu, Wow. You have a, the best thing with Ayurveda is that it gives you just like in your kitchen, you have a choice. You can make different type of same tea when you put first hot milk and then you add a tea decoction, or you put the milk and boil it and you get different taste, or you just reduce the percentage of the milk and you create various types of different teas every day and you enjoy that. Similarly, in Ayurveda practice, you have amazing freedom. You can choose n number of possibilities if you have idea of that, how you should, according to patient situation, where what you have to do. So pitta controlling is done in this. Amalaki, what a wonderful game player in this. Game changer medicines are there for all inflammations. So keep that in the mind. Use it for any number of diseases. Whereas the prabhava also is there. The combination gives prabhava. And therefore I call dravya guna. And now I'm telling for Ayurveda. Can I continue for 2 minutes more, Doctor?
Please, Tanmay, please.
Okay. So I use the two words, QIP and UIP. I coined these two words. Quality influenced based plant medicines and unique influence based plant medicine. When it says quality influence based plant medicine, it's a unique concept of Ayurveda where guna and virya, they are used, the qualities and taste are used even for healthy person and even for diseased person. But when therefore it's dravya guna. But when it comes to prabhava, that achintya, that unique active principle, when it works, the combination of all these herbs, when you combine, they create a unique results. Same like two colors when you take yellow and you take take red. Okay, you take red and yellow, you make orange. Now it's a new baby. It is not yellow, it's not red now. So when you combine two colors and make a new result, similarly, when you combine these qualities, it becomes a unique principle. So all these plant medicines with combination comes under unique influenced based plant medicines. They have a particular results also, like prabhava. So dravya guna and dravya prabhava, we should teach separate. Even alchemy, Ayurveda alchemy is also comes under unique influence based, not under dravya guna, it's dravya prabhava. Now here, whole thing is this combination is a wonder combination, which is like a weapon in your hand. You should know to cut which level of root of that disease. You have to be that smart. Even if you are not, then also if you give, you can at least remove some of the toxins from the body, because it's a very good laxative and purgation, and you get results. Even in Panchakarma, in my center in Udupi, I have here on Oceanside, so many people from all over the world comes. The fear of using some very high corrosive based medicines for purgation. I use castor oil with Avipattikar, and it gives wonderful 4 or 5 easy purgations. Person is relaxed, and cholesterol level after purgation increases. But after 5 days of controlled diet, samsarjana krama, which the word we use in Ayurveda means controlled diet plan, cholesterol, triglycerides, everything goes in normal limits. Isn't it a wonder? But the thing is this, that explaining all these things in the language of Western medicine is just like a father telling to a teenager something, and teenager says, "Look, Dad, I'm not understanding what you're talking about. Sorry. It's nothing which I understand." It doesn't mean that father is wrong. We are actually 1 generation or 2 generation ahead to explain in the language which world want to know. I give my pause to my words here. Thank you, Dr. Harish.
Tanmay, please
call me as an accidental speaker today.
Tanmay, please stay with us. We will hear very quickly from Professor Rahul about how these formulations are used, the dosages in children. And then we will come back to you, sir. We want to ask you, Tanmay, we have a question here about the large amount of sugar that is used in this formula.
Yeah,
we'll come back.
Rahul was telling, I knew that.
we'll come back to this one. Having
for the Western world is that
having
very, very seriously. Yeah,
having heard from Rahulji about the dosage in children and how whether you see some adverse effects, adverse reactions. Thank you, Ji.
Thank you. The dosage which I have been using, the adult dosage are around 6 to 10 grams a day. For pediatric patients, the dosage change according to their age. I have been using this dosage up to 5 years of children, up to 1 gram per day in divided doses of 4 to 5 doses a day, and not more than 2.5 grams a day in children between 5 to 15 years of age. All of the doses are 4 to 6 times divided equally.
Tanmeji, sorry,
Secondly,
Rahulji, we move swiftly on. Second question that's come up on the screen here. In children, how do you worry about the Prakriti types, and what is and this is a question for Tanmeji to whether we can elaborate on. Everybody hears about Prakriti types and they want to know whether you have to be careful on how you use these formulations.
Yes,
Look,
it is really difficult to. It is really difficult to assess the Prakriti in pediatric age group.
Exactly.
Who cannot speak out exactly, or who cannot make out their own, who cannot give out an apt answer to the question. So what we do is we consider the pediatric age group to be a dominant of Kapha dosha.
Kapha dosha.
So treating diseases of irrespective of the dosh predominance of that disease, we have to keep in mind that Kapha dosha is going to be dominant in the body of that child. So whatever treatment we are going to give has to be directed towards the disease dosh and the Kapha dosh which is already there in the body.
Thank you, Rahulji. Thank you so much. Please stay with us. We want to hear from Tanmeji about that issue about sugar. You used the term mishri versus castor sugar.
Crystallized rock.
Please. The high amount of, very large amount of sugar that goes into this formulation. How do diabetics respond to this? Is this, is this something they should be given somebody?
Look, now, the word mishri or sita is actually used for crystallized rock sugar. This is not a sugar which is industrially based. What you get sugar which we take, we consume, that's different than mishri. Okay, there's thousands and thousands of years since we are using this. Now, the sugar is not dangerous because it is one of the taste of 6 tastes used in Ayurveda, but the way sugar is processed chemically, it's very poisonous. Now, sugar is not just a receptor you have in your tongue, even your stomach has sugar receptors. Now when you know that sugar in Charaka, such a smart guy, he has given that if sugar is taken in a proper certain dose, it is Brahmana. Brahmana means it's nourishing. It's glucose. You need glucose. It's very important for your brain, for your cells, everywhere. Carbohydrate metabolism is based on that. But if you take it in a bigger amount, it's dangerous. It's increased obesity. It's bad for heart, even for pumsattva, even for male aphrodisiac. It's anti-aphrodisiac actually if it is taken in more amount. So the point here is this, that the sugar in this formulation is used not in that big dose when you are giving to patient as a medicine. Here, sugar is used as a medicine, not as a food. One thing should be remembered. Understand that toxicity is a plus point for a doctor. If it is in your hand, you are using this sugar with the combination of high spices. You are using all taste. You are using sugar. You are using pipali, marich, shunti. You are using here lavanga, clove. You are using here cardamom. You are using here privrata. And you are using here vidanga and amalaki amla. Actually, this combination has all 6 tastes. It is having sugar taste. It's having sour taste because of amalaki. It has, except salt, it has every taste. Okay. Now, interesting phenomenon is that this sugar is, even though if it's 50%, it's a bigger amount, but how much dose you are going to give to your patient? Is it equal to chocolate or something?
I
No,
see
no.
what you mean. So thank you.
No. It's a very little amount. And this is used as a medicine, and this is a rock crystal sugar, which is not chemically processed sugar. I hope I gave that.
Thank you. Tanmeji, please stay with us because we have another confusion about a salt that goes into this preparation with the lavana. And there is the old texts talk about different preparations and different ways of preparing with the lavana. And we are very fortunate to have Baswati ji. Baswati ji, namaskar. Thank you for joining us from Banaras. I gather you've been tasked with this homework of finding out from the scholars in Banaras about Vidya Lavana. Please, the floor is yours.
Yeah, there's a bit of difference. Yeah.
Actually, I had 6 points to make, but I'll start with Vidya Lavana and see if we have other time. So there is a section on different kinds of salts in the Ashtanga Hridayam, chapter 6 of the Sutrasthana, and they describe several different types of salt. It's in the section just after fruits. And if you look at the description, it's very interesting that different translations from the Sanskrit come to different things. And many people will say, oh, it's a Himalayan salt. It's the same thing as Himalayan salt. Others will say, no, it's Saindhav salt. And they think Saindhav salt is Himalayan salt, even though the word Saindhav means in Sanskrit from the Sindh. So you have to go to the Sindh, and Sindh, is of course, annihilated at the time of independence, but the Sindhi people scattered everywhere from their origin, which was along the Indus River. So there are these cliffs and caves along the Indus River. For some reason, they made this special salt that was actually cooling. So some people say, oh, no, that's what it is. It's a special scent salt. But I went and looked into this, and I spoke with my sir, C.B. Chasar. And actually, because I've been trained through Gurukul in the south, and then I went to the north for my PhD, I went and looked into this from many people, and they say that what they do is they take rock salt from the Himalayas. They then add a source of sulfur, high amount of sulfur, which is you can say a rock called greigite. And greigite has iron sulfide in it and a few other minerals. And then they add the fruits of Triphala, which were mentioned before, Amalaki, Haritaki, and Vipitaki, so Triphala. And then they heat it together in an earthen pot up to 800 degrees, and they heat it slow for a day, 24 hours, not a work day, but an actual, full 24 hours. And what comes out of that is called black salt, which, now we have to explain that. Black salt is actually pink in color with a little charcoal to it. And when you add a drop of water, it becomes black. And in Bengali, it's called beet lavan, which is very similar to the word Vidya Lavana. So beet lavan is also called kala namak in some places and vrat kala namak in other places. And then some people are actually thinking that black salt is made in a totally different way and that it's the same as the Himalayan rock salt, but it's Himalayan rock salt that's been man-made, man-processed. And the way in which there is processing of that Himalayan salt not only introduces that sulfur, which you can smell in the black salt, but that Vidya Lavan has special properties of cleansing, which is what we want it for, and that's why we put in the Avipattikar. Now, I've asked other people, and they say, no. Vidya Lavana is just a type of salt that's naturally occurring. It's not man-made. But I will tell you, I've talked with enough people in Rasa Shastra, Bhaishya Kalpana, that say Vidya Lavan is not, it's sourced from a natural salt, but it is itself made through the process I described. But it is in contrast to the salt that we call table salt, which is 100% NaCl. It's very important that Vidya Lavana has that extra scraping property and has those extra minerals, because the minerals are thought to replenish part of the enzymatic actions that are necessary as the scraping goes on with all those other ingredients that was shown very nicely by Dr. Rahul in his presentation of the ingredients. And I think I was pretty quick in that. So I just want to make a couple of other points, if I could, please.
Please, Bash. We
So
we also have two questions if you want to address that, but otherwise we'll leave it to our speakers.
Okay,
First question, any side effects
I-
of Avipattikar? Number two, what's the difference? So the second one we'll address with Tanmeji. Please, Bash.
Okay, so my quick points. There is a difference between Avipatti and Avipattikar, and you have to be clear when you tell your patients. If you don't tell them, they will take Avipatti, or depending on where they're from. If they're from Kerala or the South, they'll just get Avipatti. And that, as was mentioned by Dr. Tanmay, is much more focused on pitta vikriti. So where the heat is high in the body, and oftentimes the fire, the agni, is low in the body. And that high pitta state gives people all kinds of not only heat oriented symptoms, but a lot of the very, very difficult symptoms, because that heat being high without digestion creates basically ashes, right? Think of a campfire that has fire that doesn't burn well. So that's the South Indian, the Kerala Yoga. He showed the Sahasra Yoga textbook, and that's used in the South. In the North, they tend to use Avipattikar, and the difference between them is the amount of lavan. Like in Avipatti, it's 10 times the amount of the other ingredients, whereas in Avipattikar, it's like 44 times, or you saw the proportions. And so there's the lavan, there's the lavanga. Lavan is salt, lavanga is clove. So there's a difference in the clove, there's a difference in the what we call the trivrid, and there's the difference in the sugar. And so that's the difference between the two. And they have different uses. So this is for pitta disorders. The Avipattikar can be used for vata, pitta, and kapha disorders, where the main feature is that if you think of the stool moving downwards as a train car, it's like the stool is trying to move down, but the front car of the train is very dry and doesn't want to move on the tracks. So that's called vibandhi. So it's bandhi means to be tight, to be stopped. And that dryness is what causes it. And what this does, it kind of pushes it through. So that vibandhi is there. I wanted to, well, let me get through the other points and then answer your question. As a physician, I noted that 2 physicians spoke, and they both have interest in modern medicine and we can call it Eastern medicines or other medicines on the planet. As a person that's been practicing for several decades, I find that the modern understanding of the GI tract is so far behind, and this was mentioned also by Dr. Tanmay. And one of the reasons I think is because the mind-gut axis is so well understood in and integrated in Ayurvedic diagnosis and treatment. We always look at the mind. Ayurveda already knows it's a part and parcel. The mind-gut axis is nothing new. It's integral to the very beginning. And yet in modern medicine, we are always talking about receptors, and we're talking about drugs, and we are just discovering that, oh, well, maybe the mind has a part to play. Yes, the mind has a part to play, but they don't want to release into the fact that it's not just about receptors, it's about emotions that pour in cascades of chemicals, because modern medicine thinks in terms of chemicals, and that's really affecting things. And so when you have all this stuff that's built up, you need to take the mind and calm it, and then you need to bring things down. So then my next point was the fear of laxatives. So when I talk to my patients, they, you want me to take Avipattikar, but what if I have, and they'll have many bowel movements. They won't be crampy, they won't be bloody, they won't be like cholera, but somehow Americans and Europeans think that laxative means like cholera. So they're gonna like poop their brains out and then they're going to be dead. But they don't understand that this is a very different type of treatment, and the word laxative has a certain stigma around it. And so it's not a great equivalent. So when a person goes to the bathroom, empties their bowels, and doesn't have cramping, doesn't have burning, doesn't have pain, and realize, wow, I feel lighter, we need to do better counseling in Ayurveda for medical doctors to understand the difference between the purgation that happens and laxatives. And then the last part was about the sugar. And I just wanted to convey that there's a lot of misunderstanding also about sugar. Refined sugar has been originated in India, but there was also an understanding that mishri, or what's called sarkara, these are different things, all of these. And the process from taking the cane sugar and then heating, well, first of all, extracting it and how to extract it, and then heating it slowly, there is a way to make rock sugar. And that's where chemically you have the chair versus the boat in the six sugar, the glucose compound, or the glucose molecule. And so that moiety, if it sits differently, will bind the sugar kind of matrix into a different way. So there will be these cubic rocks. And that is something processed differently by the human body than the heated up, very hot sugar that creates the refined sugar where it's bleached and there's all kinds of processing to it. And so what they're saying in this recipe is use the one that is the rock sugar. And that has a cooling nature, which is why we call it misri. And it's not the same as, just regular table sugar. So I wanted to make those points and then ask you, what was the question you wanted me to answer again?
Thanks, Bash. You've done that. We had one question here about Avipatti versus Avipattikar Churna.
Right.
And I think Tanmeji touched on that. I wondered if you wanted to add something very swiftly before we move to Arun.
No, I just did. So I said that one is from the Sahasra Yoga and there are different portions of the three.
Maybe we'll take this
That's
from
best.
Tanmeji, because Tanmeji, you said you use some form of some form of calcium.
Look, I'm a person who born in North India, working there also in South also, and touching both Ayurvedas very closely. So once when it comes to Avipatti, combination of Sahasra Yoga, the book which I'm using here, that is actually having a 5 taste, but 1 taste is missing in that, and that is with lavan. Whereas if you go to use Avipattikar, it is, as Dr. Bhaswati given that, with lavan addition to that. So
could you tell us a little bit about the Godanti that goes into?
Right. Then you said that, is there any side effect of this? Well, I tell you that I have noticed side effect that sometimes this can give huge amount of, some people have a more purgative results. So if Godanti is added to that, its purgative action is reduced to a certain extent. This is not my research. This was a research of my guru, Dr. Muralidhar Sharma, my teacher. Look, the problem with Ayurvedic community and all medical people, once they pass out, then they are alone. But actually, we should have a coach with us always, just like a sportsman has a coach in their life.
So very swiftly, a question that's come up: the difficulty of recommending this as a over-the-counter OTC kind of formulation. What you're saying is one must handle these things with care. Is that correct?
Right.
Yes.
Right. This is not just you can go on the shop and you just say that, okay, you give me and I just take it. No. It can give purgation. In some cases, it can be very, very strong purgation is seen in some of the patients, and cramps in abdomen also had been seen. And it has to be explained to the patient before giving to them that, look, there can be possibility, look, Ayurveda medicine is not generalized like allopathy, I will use the word Western medicine, where paracetamol is given to all, same, or diclofenac. Here it is very much tailored, customized according to the patient, So if there is a Vata Prakriti person, he may not have that. But if there is already a very high Prakopi Pitta with Apana Vata disturbance, if this person touches Avipattikar in a little bit higher amount than normal for that person, which doctor has to decide, Ayurvedic physician should judge, it can be a very toxic in the way of, can give a very high purgation.
Tanmeji, before we go on to Arun, who's been listening, Arun Chakalingam, who's been listening very carefully, and where I'm hoping he will address something about how the systems of medicine, the Eastern and the Western, can come together. Before we go to Arun, Tanmeji, one very quick question about the need for education and how are we going to make the East and the West start understanding the two sides, because you're there based in Mathura, part of your responsibility is in that space. Do you want to give us just in a few words, whether it's difficult challenge, or it's a
No, it's
easy
not.
one?
It's not very big, difficult challenge nowadays. Look, when it comes to acceptance, as an academic administrator, if you wanted to listen to me, I want to tell you one thing, that basic fundamental of research for scientists is culture-based. When it comes to a Western medical system, look, I will give you one analogy. There was a use and throw pen was never been used in India. Indians use the ink pen, and father used to give to his son and son to his son. We believe first in repair management than replacement management. But if you come to a Western, it's a philosophy of life. You know, if our shirt used to get torn, we used to have a rough. They used to repair it. And same is a concept when it comes to an Indian scientist, an Ayurvedic scientist to work, he focused more on repair than replacement. Replacement is a last resort. So the point is this, that we should first tell, okay, look, we belong to an ideology of replacement. When we belong to ideology of repairment, and both are okay. When Indian diaspora never had this psychology of replacement, even in pen. So Renault was the first pen introduced to India by France, which cannot be opened, which was blocked. You cannot open, you know, you have to throw it. So Indians were patternized. The pattern was made to throw, learn not to keep. We used to keep even the brush to use it for, Hindi mein bolunga main, wo nala dalne ke liye use karte the. So, you know, we are the people who have that ideological differences of research, you know.
So Tanmay, we will take this point up because I can see we are coming up to a 90-minute. These are taster sessions. The idea here is to bring minds together and to open up dialogues and discussions.
Right.
And see,
I'm concluding it. We have to, yeah. So one conclude in 50 seconds. If you want to bring academic together, thank you.
Tanmay, we've lost you there.
Okay, if we want, am I audible?
You can.
Yes.
Am I audible?
Yes, we can.
Okay, so if we want to have an academic bridge between both medicines, we have to start from fundamentals of the research, fundamentals of concepts, and then both can accept it, no problem.
Thank you, Tanmay.
Two concepts can come together. If they're different too, no problem. Both are good for the people. But
the wish here is that we enable.
One is replacement, one is repair.
The longer term vision and wish is that we enable an interaction between North America and India.
There is some problem in my side of internet.
And that we have a vibrant education program, we have a vibrant research program, and this is already happening in Toronto with the interactions that are going on with the university health networks. And before we go to Satish ji for some thoughts on this, Arun ji, the floor is yours. Out of these tasters, we are given 90 minutes to pull many things together. Sometimes we are successful, sometimes we go off in tangents, but we want to bring you on here just to give your feedback on.
Thank you, Madan ji. You are actually speaking to a converted one, not a to be converted. Yes, we believe that Ayurveda, Siddha, and all our traditional medicine, we talk about the human body as a whole, not as individual compartment. We don't treat heart separately, we don't treat mind separately. We take as a whole. I think that is what is lacking in the Western medicine. We have specialized, we have subspecialized, and we are super specialized. So that means at the end of the day, a super specialist may charge a lot of money, but doesn't know much about what's happening with the rest of the body. I think this is where I think we can educate and contribute to the Western science. So what does the Western science ask? They will believe it based on evidence. based on randomized controlled clinical trials. But we are rich based on traditional knowledge, time after time, because you are a genetist. So in these days, we are talking about genetics and looking at the genes. But when you go into the villages, either in Tamil Nadu or anywhere in India, the Vaidyas, the doctor, will ask, oh, who is your father? Who is your grandfather? He had that disease, so it may be carrying on in the genes. I agree, some genes might skip a generation and then hit a generation after. But that kind of the modern thinking is now looking only at a short focus and not looking at the whole picture. I think this session that Satish ji and Verma ji and Madan ji, you're all planning to put together with Harvey, who is specializing in Eastern philosophy and Eastern medicine, will certainly open up a much more dialogue and probably bring closer. We have been trying to push this in the Western world for the last 10 years, but it'll be a time coming to a maturity. Thank you for the opportunity to share with you. I really enjoyed the two talks, and especially Rahul ji very well explained some of the nuances which I was not aware. And also, Tanmay ji, you have given a beautiful example of repair versus replacement. Thank you.
Arun, we are very fortunate to have you here. You have an undergraduate degree in electronics and communications from the University of Madras. You then did a Master of Science in Biomedical Engineering from IIT Madras. And then you did a PhD in cardiac physiology and pharmacology from Memorial in Newfoundland. We are fortunate to have somebody like you guiding us in this effort. And Dr. Harvey, you are there to take us forward in what we are hoping will be a very important base for North America. Perhaps you wanted to conclude with a few words before we move on to Satish to draw this to a close. Thank you.
Well, thank you very much. This was incredibly educational for me, listening to our colleagues and giving me some real insights into Ayurvedic medicine and the history of it, the deep, rich history and the complexity and the notion that they've understood for a long time that things just don't occur north of the ears, right? Or in the West, in fact, I try to keep pushing my others start thinking and feeling south of the ears, integrating the mind, with the body, with emotion, with the spirit. And that comes out of indigenous wisdom as well, that integrative approach. So there's lots of to consider with indigenous and Eastern approaches, the synergies, the similarities. And the problem with Western science and something like randomized controlled trials is it's reductionistic and it can only focus on a small lens when in principle, if we're holistic, looking at whole systems, and it's not just my internal system, it's in the environment around me and it's porous. I mean, energy is flowing in and out all the time in our bodies, right? We're living in energy fields. And we don't in the West have the concepts or the scientific tools to study this in a holistic way. We can just take a particular slice, like you do a CAT scan, right? Slice, 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 and you try to put it together. So, and that's not, I think, fully appreciated how limited Western science is. So if you're only going to rely on, quote, Western science, it doesn't really give us the capacity to truly understand the mechanisms and the wisdom of what is happening with Ayurvedic medicine and traditional Chinese medicine. So that's partly my concern is when in the West say, okay, so what's the evidence? I think that in some ways a really naive question, and you have to and I used to be very much a strong empiricist myself, right? And a statistician in empirical science. And the more you get into understanding qualitative approaches to research and mixed methods, and that is happening more now in medical research, getting into more qualitative mixed methods, but we still have a huge way to go to to really to get a level of understanding. So, and I
We
really
are looking to the veterans who've been in the field for decades and who've come up to this realization that we need to connect with the East. And we look to all of you in Toronto, and we look forward to this event in June, and we look forward to continued interactions. And I'm sure Canada-India Foundation, under the chairmanship of Satish Ji, will make this happen for us. Satish Ji.
Thank you. Thank you. It was
Satish Ji, can I interrupt you for about 30 seconds?
sure. Please go ahead.
Yeah, sorry to interrupt. There's one point which Harvey said is very important. We are looking at the whole, not just the body alone. I think that's what this Congress is trying to emphasize. The environment where we live, the amount of spoiling that we do to environment is going to come back to us to hurt us. I think we should look at the whole system approach. I think this is coming beautifully through Ayurveda, and we can do it well in Toronto.
We look forward to being with all of you in June in Toronto. And more than anything, we would like to keep this dialogue going, perhaps for 18 months to 2 years or 3 years to come. And by then, substantial programs of study and research that is already initiated by Satish Ji. Satish Ji.
Thank you so very much. It was a lovely presentation. I thoroughly enjoyed, and my quick thoughts basically is that, of course, we know the importance of Ayurveda in our life. If you talk to anyone, nobody wants to go through the route of replacement. Everybody wants repair. And if you are given a choice between a herbal-based medicine, plant-based medicine versus modern Western medicine, I would say that nobody you will find who would say, I would like to go. I think they are by not choice, but no other alternative they find which could be convincing that way. So, of course, we are living in an era where everything need to be supported by evidence, and a perception need to be created that way. But I strongly feel and suggest that on the prevention side, of course, disease management side, there are a lot more work to be done. But on the prevention side, we have a very, very low hanging fruit, and majority of the population, which we can target through Ayurveda speaker series and other initiative, is on the prevention side. And if we are able to touch that part, I think they will not need for any kind of a disease management down the road. So bringing up more experts and how we can make this easily accessible in this part of the world, our outreach efforts, and some of the champions who understand both the sides of the medicine, how they could be the strong advocates. I think these are some of the thoughts which we need to work, as Harvey mentioned very effectively. Nicely. That we need to create small glimpses of different videos, like all these benefits of different formulations, that how a layman can use that as a part of their preventative health or good health. I think that's some food for thought. We need to work on that aggressively. With that note, over to you. Thank you.
Thank you, Satish Ji. I think we have taken up more than the 90 minutes we were allocated. I want to, before I hand over to Pallavi Ji, Arun, namaskar, vanakkam. Thank you for being with us today. And Harvey, I don't know what language to use to thank you for being with us. I don't know, Tibetan or something, but I can see from what you have in the back. Thank you for being with us. We look forward to more engagements with Toronto and with North America. Pallaviji, thank you for.
Thank you. Thank you, Dr. Madan. Amazing, amazing. Today's webinar was just beautiful. I just can't express how beautifully Avipatti and Avipattikar was distinguished today so elaborately. With this, seeking blessings from Lord Dhanvantari, I take the opportunity to thank our special guest, Professor Arun Chokalingam and Dr. Harvey Skinner for being with us and giving their such valuable inputs and enlightening us. Our today's speaker, Dr. Rahul Gujarati and Dr. Tanmay Goswami, thank you very much. Dr. Tanmay, you have been amazing for joining at the last moment. And I really feel hurt Dr. Meenakshi could not join today. But Dr. Tanmay, you have done a fantastic job. My sincere thanks to Canada India Foundation, Mr. Satish Thakurji, thank you very much. And Tatastu from USA. I always miss Gregory Bhalaji. He's not come here for quite some time. My thanks to Consulate General of India in Canada, Canadian College of Ayurveda and Yoga. Thanks to our partners from Europe, European Ayurveda Association and Association Ayurveda Academy, also from US, American Association of Ayurvedic Professionals, and Ayurveda Union of Midwest, Dr. Ashlesha Rautji, she was with us today. Dr. Harish ji, it's amazing. You have started such a beautiful string of knowledge which is going on. Dr. Bhaswati, the enlightenment you've done on salt, lavan, it was fantastic. Thank you so much. And I'm very thankful to Y Media and Pravasi Television for the strong support. My sincere thanks to the audience for their valuable time, and of course to our family members who spare us on this special on these Sundays. And next next webinar is on 2nd April. It's on Jatyadi Ghrutam. It's again a very interesting topic. And with Chaitra month coming up and the new year starting, I give my best wishes to all. Thank you, Madanji. You are last but not the least. You've done fantastic. Thank you, everybody. Bye-bye.
Namaskar.
Namaskar.